It's frightening because dangerous blood clots are becoming more and more common in some virus patients. They form all over the body and can cause deadly strokes. KETK Today anchor Isaac Ramirez explains what doctors have uncovered so far and the warning signs to look out for in our special report tonight, COVID-19 strokes.
Jonathan Keith Goodman devoted the last 11 years of his life working in state prisons. The 52-year-old suffered a stroke at home and later tested positive for COVID-19. Doctors could not save him. Unfortunately, this is becoming more common during this pandemic.
In fact, about 5 days ago, I saw a patient with what I presume to be problems with clotting.
Dr. Bob Carith is the chief of emergency services at UT Health at Tyler's Level 1 Trauma Center. COVID-19 has offered plenty of new lessons.
We've learned the fact that the problems in the lungs may be stemming actually from very tiny little clots called microthrombi.
Clotting is the body's natural reaction when you get a cut to stop the bleeding. But when it happens inside your veins or arteries, it can cause a blockage, which can lead to a stroke. Symptoms of blood clots include pain in the legs or chest, swelling in the arms or legs, and skin discoloration. ER doctors all over the country have witnessed this clotting, like Dr. Rick Pescator in the Northeast.
We have autopsy studies now that are showing microthrombi, tiny, very small clots that are found diffusely throughout the lungs and even in the brain as well.
An MIT study found almost 3/4 of people killed by the coronavirus had clots.
Something that needs to be
Dr. Stephen Warwick, an international stroke expert at UT Austin, says a patient can be showing mild or no symptoms of COVID-19 when a stroke hits.
It could be it's not causing the respiratory symptoms and fevers, but it's causing some of the other effects on the heart and blood clotting system.
An easy way to remember the signs of a stroke is the word FAST. F stands for face drooping, A for arm weakness, S for slurred speech. And if you see any of these, it's time to call 911.
Well, we've now found out that actually we want to keep people off ventilators as long as possible. And we only want to put people on those intubated tubes and on those ventilators only if we've exceeded every other possibility for treatment. And we found that people actually do okay.
UT Health East Texas officials are urging people not to delay preventative care and not be hesitant to leave the house and seek immediate help.
Suddenly, the amount of people showing up for stroke care is decreasing. That's very concerning to me because if you are seeing potential symptoms of stroke, you need to get to one of our hospitals immediately.
Dr. Creeth says his team has been on top of this virus, but thinks this pandemic could possibly get worse before it's all over.
I think opening up will obviously expose people to asymptomatic carriers that they're unaware of, even have the disease, and then they may get sick themselves.
A reminder to social distance while practicing good hygiene. Isaac Ramirez, KETK News.
And it still will not know what's exactly causing these clots, but treatment can be as simple as blood thinners.